how we take a patient who has no teeth to give them full arch zirconia fixed teeth. Hey guys, so it's Dr. Mo here in one of our surgical rooms. So what are the actual granular steps one by one? So typically when you come to us initially, we'll listen to you very carefully to try and understand what do you like and dislike about your teeth and what are you hoping to achieve. After we've diagnosed the problem and made sure that you need implants, we will typically take a CT scan. So if you can put the CT scan up on the screen, please, so that we can examine your jaws and do what we call virtual surgical planning. So if we have a patient like this here, we can do a digital mock-up to allow us to plan the surgery and do the surgery on your skeleton without having you in the chair. So that allows is for much smoother surgery on the day when we see you. So we've got someone's skeleton here. We're looking at where they have bone, where they don't have bone, because often we get that question. So maybe your dentist has told you that you don't have enough bone, or maybe your dentist has told you that you can't have implants. Why is it that we're so confident? And that's because we utilize technology. So when we have technology like this, we're able to often even 3D print your skeleton so we can have a look and do the surgery and make sure we're well prepared. Often we will make computer guides so we know exactly where to drill. And then typically on the day, we will utilize photogrammetry. So if you can take those photogrammetry scan bodies. So this is what photogrammetry looks like. So this is the next generation of implantology. So instead of taking molds and gooey substances of your mouth, we now connect these dominoes and we use a camera which is accurate to 2-3 microns. And it's as small as something like this. So we have an intraoral scanner here, the Trio 6x3 shape, and we're able to scan your mouth and get a digital file. So we are no longer using molds, which are messy, painful, they make you choke, they're inaccurate. So we have a digital file. And then we're able to create, if you can open the other HTML of everything stitched together. So we're able to create almost your avatar. So by putting all the files together, so we have a patient here where we've scanned her face, scanned her skeleton. So if you rotate that 180, so if you keep going on the rotation, keep going, see over here, we've actually gotten this young lady's skeleton and connected it to her face and her soft tissues. So we get an ideal smile being created. So as part of our planning. So we're able to make a custom smile for every single patient and know exactly what the final outcome will be before we even start. On the day of surgery, we sedate you so that you're comfortable. You will not remember being here. You will not remember the surgery itself. Typically, you don't remember how you got home either, so that's why you need an escort, but it's wonderfully relaxing for patients. So because you do not remember anything, there is no need to be anxious. There is no need to be nervous about your appointment. We will fit you the teeth the same day. So this is a very young lady. She wanted very white teeth on the top jaw. So these are 3D printed ceramic teeth. So you will get your teeth the very same day of your surgical correction. And then we will let you go for 2 to 3 months for everything to heal up, for the jaws to heal. And if you maybe show a photo of soft tissue healing in the mouth. So when you come back, this is what the implants look like inside the gums. So we can see the implants there and it's healthy gum. The gum is healed around the implants. And we will rescan your mouth because the geometry of your mouth has now changed. Once we've done that, you're ready for your final teeth to be connected on. And we'll get feedback from what you like and dislike about the shapes and what color you want. And at that point, if you want to show the final zirconia. So we are extremely proud about the fact that we do not use plastic teeth. So PMMA, acrylic, these are terribly unhygienic materials. They are cheap materials, easy to work with, but that is their only advantage. And we do not want to use something in healthcare where its only advantage is the fact that it's cheap. So other dentists do this, other dental groups push this, but we only use ceramic zirconia. So you see here we have a very beautiful restoration, hygienic, easy to clean, biocompatible, strong material to make sure that it lasts. Yes, it's more difficult to manufacture. The engineering of it is more difficult. More technology is required, but we love that. And we never want to pick something just because it's easy. So this is something we can guarantee for 20 years. We do need to see you once a year, but we can guarantee it then for 20 years. So from the front, it looks like this. Often patients ask us, okay, how do you keep it in place? So if we can show the prosthetic from the screw access channel. So if we look at the same teeth from the top, so almost if you were to put your head back, Here are our screw access channels, and we have these little clamping screws with hex heads on them. So we keep this bridge in place. And then we close these with a white filling material so that you can't even tell that they're there. You can see the palate is completely free, and because you have a free palate, unlike a denture or a bulky prosthesis, you're able to enjoy your food a lot better. And it's the same thing on the bottom. So as part of this process, there's only one surgical appointment. So patients are delighted. There's only one appointment where you have to have, surgery, and we sedate almost all of our patients for this unless you ask us not to. So we are always trying to make this as comfortable as possible for you. So we do sedation. Every other appointment is a very comfortable prosthetic visit. It's more conversation that you and I are having, that you're having with your dentist, and there at no point any molds or gooey substances going into your mouth. So this is a fully digital workflow, and we're extremely proud of that, and that is unique to the truly dental workflow. So how can you book an appointment? You can make a free consultation with one of our treatment coordinators. You can click on our website. You can ring us, email us, whatever is convenient for you. We have locations nationwide, and we look forward to helping you achieve a beautiful smile.